Hello, I'm Dr. Wendy Bridges, and today's talk is about something that doctors and patients are taking a lot of interest in, and this is gut health. If you've been following any of the celebrity food trends, you'll be realising that many people are changing their diet and feeling the better for it. I'm not here today to tell you what to eat and what not to eat. We are all individuals with different responses to food and different nutritional requirements. I'm just sharing some of the things that we do know about gut health. So first of all, let's talk about what we mean by gut health. There are germs that live inside our gut and they're necessary for digestion, and that's called the gut microbiota. The good germs, the ones that help us digest things and release nutrients, are called probiotics. Probiotics need food, and the food for those probiotics is called prebiotics. So when babies are born, they don't have any germs in their gut, but they need that to digest food. Babies get those good germs into their gut from mum's birth canal, or if they're a caesarean-born baby, they get it from being around other people. Breast milk is full of prebiotics, which feed the good bugs, and many formulas have pre and probiotics added to them nowadays. So our gut gets full of these good bugs. So what do we know about healthy gut flora? Well, we do know that natural foods feed healthy gut flora, so fruits, veggies, nuts, legumes, seeds, they're all full of prebiotics to feed your own probiotics. There's a big industry selling probiotics, so taking those good germs in capsule form. Unfortunately, there's not a lot of evidence that this actually does anything to improve your gut health. Also, there's not much evidence that it's harmful. There are some people who can be harmed by taking probiotics. There is a link below explaining about that, but do consult with your health professional if you're thinking about taking that kind of treatment. So what else can we do to support our good bacteria? So things that support the good bacteria are fermented foods. So that's things like kimchi, kefir, kombucha, natural fermented yogurt drinks, and sauerkraut. These are all going to feed the good bacteria. Fibre is also wonderful. So fibre, soluble and insoluble, they're both healthy things. And fibre does help to keep your gut healthy and grow the good bacteria. So there's different ways to do that. First of all, fibre does contain things that are prebiotics to feed the good bacteria. The other thing is that if you eat the food and it sits in your gut for a long time, so if it goes through slowly and you suffer from constipation, this can be a cause of a lot of gut discomfort. Many people experience abdominal pain, bloating and lots of gas because the food simply takes too long to pass through. When it's there for a long time, it feeds the bad bugs, and those bad bugs are fermenting the food and making a lot of gas. So if you take more fibre and the food passes through more quickly, you might be able to resolve that problem. Also, fibre is a wonderful protection against obesity, diabetes and colon cancer. So increasing fibre is definitely good for your gut. So other things we can talk about gut health. Eating a natural diet has been proven to be a great support for mental health, and by that we're talking about eating, again, fruit, veggies, fish, nuts, seeds, legumes, and avoiding processed foods. So other things we know about healthy gut is that if you have a baby who's born into a family that's strongly prone to having eczema, if you give probiotics to mum and baby, you can help that child not to develop eczema. Unfortunately, that has not been proven to be the case for other food allergies and for asthma, but research is continuing. You may have heard that you can take the healthy germs from the feces of the healthy person and put it into the gut of the person who's suffering from a bowel disease. So this is called fecal transplantation. This has proven to be an effective treatment for people who are infected with a germ called Clostridium difficile, or for people who are suffering with ulcerative colitis. It hasn't been proven to work for many other conditions, but research is continuing. We do know that having a healthy gut microbiota is associated with maintaining a healthy weight. So it's not the kilojoules that we consume that actually make us put on weight, or it's not just only that, it's the kilojoules we absorb. And those germs are living in our gut and they're breaking down the food and releasing the kilojoules and nutrients to be available to us. We know that in people who have obesity, that they have a different lot of germs living in their gut to people who don't have obesity, and that they have a different lot of germs living in their gut to what they will have when they lose weight and become not obese. So definitely enjoying that healthy diet that we've discussed before can help to get the right germs and the right weight. All right, so I hope that's been an interesting talk about gut health. Still many things we don't know. Take a look at the links below and talk to your health professional if you have concerns about your gut health. I'm Dr. Wendy Bridges. If you need health information from a reliable source, I'm a GP. Subscribe to my channel.